Now, even as rains continue to hammer on, India is seeing a rise in COVID-19 cases across various states like Kerala, Tamil Nadu, Maharashtra and Delhi, which has caused health authorities to release advisories requesting public vigilance. As of yet, there is no cause for alarm, but sporadic spikes are being reported. The Karnataka Health Department has just issued latest COVID figures, and the tally now is 47 active cases, of whom 9 tested positive in the last 24 hours. In Delhi, too, cases have spiked to 99 from Sunday's tally of just 5. A latest cause for alarm is West Bengal, which has reported 4 new cases on the 25th of May. A 31-year-old woman and a 12-year-old child, both from the same family, tested positive for the virus. According to hospital sources, the woman and the child did not require hospitalization and are currently stable and recovering at home under the observation of the district health authorities. The Union Health Ministry states that there are presently over 1,009 to be precise, active COVID-19 cases in the country from the earlier 257 reported till this morning at 8 a.m. Most of the cases are mild, according to health officials, and can be managed at home. The spike, however, is not a cause for alarm. It has put health authorities on their toes, particularly since sporadic cases are being reported across various regions. Kerala has the most active cases at 95, followed by Tamil Nadu with 66 and Maharashtra at 56. The other states reporting low yet significant case numbers include Karnataka 47, Puducherry 10, Gujarat 7 and Delhi 5. Tamil Nadu, Maharashtra and Delhi, which has caused health authorities to release advisories requesting public vigilance, and the Union Health Ministry has suggested some basic precautions, particularly in public or populated spaces. Citizens have been instructed to use masks in heavily populated areas, practice normal hand hygiene, and don't travel if they're feeling unwell. Although the increase in cases has not caused panic, authorities remain vigilant to ensure that the spread is contained. The Health Ministry advisory has come out due to the rising number of COVID-19 cases from just about 250 cases on Sunday to now over 1,000 cases, 1,009 cases in total. And so far, it has been the maximum incidence of cases have been found in Kerala, nearly 100 cases, more than 60 cases in Tamil Nadu and more than 50 cases in Maharashtra. Some new COVID-19 variants as well, including NB.1.81. Although they are posing a low public health risk, their spike protein mutations are causing concern because they tend to exhibit increased immune evasion as compared to other variants of COVID-19. On the screens now is a heat map of where the maximum COVID cases have been found in India so far. The latest state to report COVID cases is West Bengal. 4 new cases coming up in West Bengal, even as Karnataka and Puducherry too continue to report significant number of cases. Union Health Ministry has issued an advisory, and it has told people to not travel if they are unwell. The only silver lining in the situation is the fact that most of the cases so far have been mild, and health officials say that they can be managed at home and there is no need for hospitalization so far. The public has been asked to take basic precautions in terms of using masks in crowded places and also follow their normal hand hygiene as well. And of course, avoid any kind of unnecessary travel, especially if they are feeling unwell. These are some of the basic precautions that the Health Ministry has put out in its advisory. Responsible for rise in The new variants that have been responsible for a rise in COVID cases include NB.1.81. That's according to the World Health Organization's preliminary assessment. The new variants tend to have increased immune evasion despite the fact that they've been mild so far. These are the new variants which have caused the spread of the virus initially in China and other parts of Asia, and now they've reached Indian shores with the total number of active cases above 1,000. A sharp rise in COVID cases putting health authorities on alert across India. Delhi, number of cases reported in Delhi, in fact, crossing the 100 mark at over 104 at the moment. Sharp rise from Sunday to today. The latest numbers are put out by India's health ministry. It's spreading to newer states and more incidents from current states as well. Kerala, Tamil Nadu, Maharashtra and Delhi leading the pack when in terms of reporting COVID cases. And the latest to join the list is West Bengal with 4 new cases. Although there is no cause for alarm, sporadic spikes are being reported across the country, and that is the reason why be it the Union Health Ministry or the Karnataka Health Department, they've all issued latest advisories and COVID tally figures, which seem to have spiked in the last 24 hours, specifically speaking. In West Bengal, 4 new cases been reported on the 25th of May. A 31-year-old woman and a 12-year-old child, both from the same family, testing positive for the virus. Both have not been asked to hospitalize. They are recovering at home under the observation of the district health authorities. Cases were just about 257 as of Sunday, and from Sunday to today, there has been a near more than threefold jump to over 1,009 cases. We have now Dr. K. Rambabu joining us on the broadcast from Vishaka Health Sciences. Thank you, Dr. Rambabu, for taking time out to be with us. Talk to us about the spread. Although the health authorities say that these are not the new variants are not a big public health risk in terms of people contracting it can be quarantined at home and taken care of. They are spreading fast.
Yeah, actually, this is only the Omicron variant mutations. So what we are seeing, Omicron is already established in USA and also Europe in 2023 itself only. It's a routine thing. So whenever there is a seasonal variations comes, the JN1 variant is having the mutations. So my perception towards this one is this is a pandemic wave like that. So all over the world when it came, so there is an endemic things will happen towards the some areas. So if you take the Singapore, there is another mutation is there, and Hong Kong is another mutation. In India is an now it is the NB 1.8.1 mutation is there. So endemic mutations. So when comes, so it's a sporadic wave like things. So we can expect. So no need to panic because all the cases whatever is coming is with a little manifestation only, like with fever, cough, cold, some sore throat. Some people are having the loose motions, conjunctivitis, and some vomitings are there. Only my appeal to the public, just be aware about the children less than 1 year and more than 60 years of the old people, pregnant, lactating mothers, and the comorbid conditions, people like hypertension, diabetes, cancer, HIV, kidney conditions, who the people are using the steroids, particularly rheumatoid arthritis and the collagen vascular diseases patients, and COPD patients. These people should take the precautions, and whenever the people are coming to the schools or the colleges or the employees who are entering into the house. So please take the precaution and again start the reverse isolation. Take yourself and use the mask in house also. That is most important one. And again start the public with the COVID appropriate behavior, particularly the hand hygiene and also the mask wearing, and don't go to the crowd places.
Right, those are the precautions that the public has to take. But I want your view on these variants, and more importantly, the fact that we're talking about this at a time when there are more than 1,000 cases in India, even as it continues to spread far and wide across Asia and South Asia as well. How much of a concern is this at this stage, in terms of its spread and what the authorities need to do?
Definitely, there is a spread will be there because it's a seasonal variation. Monsoon is coming, natural, normal influenza, or otherwise swine flu variants, and also the COVID is also one of the particular in that. So nothing particular about this one because of the seasonal variation. So it will come and natural mutations will occur. And if you take the JN1 variant, already more than 30 mutations already occurred, and we are seeing the only two or three variants of the this LF7 and also the NB 1.8.1. So I think that so already so we have seen the alpha variant, delta variant, and the Omicron. In that Omicron, these are the submutations are there. So nothing that much panic about the thing. Only so my appeal to the public that don't panic about this vaccinations and other things because we prepared the vaccine Covishield, Covaxin, and the Carbovax is the mainly for the alpha variant. And luckily, fortunately, it was worked with the delta variant also more than 80%. But Omicron, so we are not prepared that vaccine. And with the booster vaccine, we are having the already antibodies already there. And we have seen that third wave and the fourth wave is also just they came and went off like that with the small symptoms without ICU admissions and without dropping of the saturations. And I expecting that definitely there is a rising of the rising things will be there, and people will become positive. So whenever you are going to do the testing, and there will be little more rising also will be there for a certain period. There will be rising will be there, and till now we have not seen that any admission in Andhra Pradesh state also. So we are taking all the precautions like preparation of the hospitals and preparation of the LMO tanks, so oxygen tanks, ICU beds, so everything. So we are already ready with that PPE kits and protecting the doctors, and with some medicines like remdesivir and the cocktails. All those things are we are ready. But I don't think so that any need of the admissions are there till now. So in Andhra Pradesh, there are only less than 4 cases are positive. All are home isolations. All the tests are done with the neighbors and all the relatives. So everybody is negative. So no need of panic about this one. Definitely there is a rising of the number will be there, but you please take care of the COVID appropriate behavior, and reverse isolation is most important in this condition.
So net, for all those watching this broadcast, you're letting them know that there will be a rise in the number of cases will again could go up even further from here. But this is not the reason why you need to be worried. All you need to be is cautious and preventive, correct? Because the cases, if you're talking about 1,000 now, it could go up even further. So no matter how many the cases go up further, one should not panic, and one should not be alarmed, because that is natural, you're saying, for the season in which we are.
Yes. Definitely. So because this is a natural mutations will be there, and even if you can see there is a flu shots will be there in Europe and the USA every year. So they will manufacture the new variant, new mutation vaccine for them, and every year they will take the flu shots also. So this a natural course will be there. Only my appeal to the public that because this is a pandemic of the all over the world it came, so that's why you will get the sporadic wave. So almost all over the world, so it will come whenever there is a seasonal variation is there. So that's why number looks like little bit more. But my appeal to the public that no need to panic anything.